Hello.
Hi.
So you are, I think, what is it, about 10 days or maybe 2 weeks since we did your
2 weeks,
2
yep.
weeks since upper lid surgery. So you are very young. I'm not going to reveal your age, but you're quite young.
I'm 29. You can reveal it.
All right. So you had some excess skin you felt off your upper lids, correct?
Correct. Yeah, I've had it, I feel like, my whole life, but really the past couple years is when I really noticed it, and it really became bothersome. And I always looked in the mirror, and that was the first thing I looked at. So I decided to just take the next step and come on in.
But at a young age of 29, you felt you were ready for surgery?
Yeah, it's funny when I tell people I got the procedure done and they asked, "You're so young." Well, I gave them the response, well, what's the correct age? Because really it's genetic. So I felt like, there was really no perfect age when I should get the surgery done. It was just something that bothered me, so I decided to do it.
So we did an upper eyelid blepharoplasty. That's what it's called, or upper eyelid lift, some people call it. And then we also did an ultra clear laser to the lower lids, at a light setting, just to improve that a little bit as well. So which was more painful?
Honestly, neither was painful at all. I expected...
That was not a trick question.
I expected, honestly, more pain. I would say I felt a little bit more sore on the upper eyelids. It felt more like a bruise rather than pain. So I feel like I had a really good experience afterwards.
No pain meds, or you took some?
I took pain meds I took the Oxy for 1 day and then Tylenol for a couple days after. But really I didn't need the Tylenol. I took it more for inflammation, to recover, but I was not in pain at all. I felt great.
How long before you went back to work?
I went back, so I got surgery on Thursday. I went back on Monday, and I wore sunglasses.
So that's Friday, Saturday, Sunday, Monday. So 4th day post-op, you went back to work.
Yes, I felt great.
And how did it go? Like your colleagues and your strain or fatigue or anything like that?
I felt great. I wore sunglasses, so I didn't scare anyone. But everyone was very interested, and I was excited to share my whole experience of healing and show them what I did.
So now that you are 2 weeks in, on a scale of 1 to 10, did you make a good decision?
12. 12 out of 10. I would recommend this to anyone. I had been thinking about it for a long time, and I really don't even know why I didn't do it earlier, because it's something you look in the mirror and you see every day and you don't like about yourself. And I just feel, like I said, it was a genetic thing and not age related. So so happy to do it, especially before my wedding next year.
Awesome. Congrats on that. But
thank you.
If you notice, there's a couple of areas of still some redness there. That is very typical at this stage. It's only 2 weeks in. You can expect a tremendous amount of improvement, in the next few months. The scar is going to fade almost to nothing. You can't even find it in many cases unless you look very, very, very closely. You can start putting a little bit of camouflage makeup on it if you'd like right now. We talked about some minor scar management strategies, earlier, but you look fantastic, and it's only going to get better from here. Thank you.